Okay, go on.
Hi, this is e-patient Dave, and I'm at the ICSI IHI Colloquium in St. Paul in the middle of May, and I'm here with Silke von Esenwein, is that correct?
Yeah.
From Emory University, who has a poster here that really caught my eye, because it's about how a Safetynet community is using an online personal health record, and this is a really challenging population, people with a mental health diagnosis and a significant comorbidity as well. And this is a project, the poster is the outcome of a project funded by AHRQ, the Agency for Healthcare Research and Quality. And it just so happens that last night I got a comment on my blog that made me very happy that I ran into Silke. A doctor posted a comment. He said, "I really enjoyed the talk you gave at Grand Rounds here at Mass General. I got a lot out of it, but I did have one big question. When you got the initial diagnosis, you went into research mode in a big way. I thought, this guy's an MIT grad. He's obviously smart. He's got top-notch research and communication skills. Same thing with the other presenter that day. My question is this: what about folks who lack those advantages? Are there resources and recommendations for institutions that want to empower e-patients who might not be self-starters? And what better example for this than a Safetynet, very low socioeconomic status with mental health as well as a physical health challenge. So Silke, what do you have to say?
Yeah, we get this question a lot. Are people with serious mental illnesses that have very low education, very low health literacy, even able to deal with these kind of digital resources? And we found that it's actually much easier than what people think. So when we asked people if they were comfortable with it, actually a surprisingly high number of people reported they have access to computers. About 2/3 of them use email on a regular basis. They know how the internet works. And those people that didn't feel comfortable with the internet, we just gave them some pretty basic training. If anybody had no idea about how to use a computer, it takes about 4 hours of one-on-one tutorials and instruction and tasking to get them up to speed. And then they're quite proficient. They know how to keep their searches safe, they know how to protect their information, they know how to find good information, and it's really easy. Once you get them up and running, they recognize pretty quickly what a great resource the internet is and what they can do with it. So we haven't found any problems with that.
So have you found, I know people in my family who I've spent much more than 4 hours with who don't seem to understand. Are there any particular methods you use? Will you be publishing those?
We actually developed a computer skills assessment and a computer training module, so where we assess people first, we give them a quick quiz to see where they are, and then based on the outcome of that quiz, we kind of shuttle them towards certain modules that we know that they're lacking on. So if they know nothing about computers, then we have modules that we've kind of created together from the internet resources and different kind of tutorials about, what is a computer, where's a mouse, how do you do this, from people that know basically what's going on, but they needed some information about internet security, then we just do that module with them. So we had a very proactive nursing student who actually put this together herself, and it was a very good tutorial. You definitely want to have somebody who's a really good teacher. Just because you're good at, so it's just because you know a lot about the internet and electronics doesn't mean you're a good teacher, because you might be so good at it that you can't understand it. People don't take to it naturally. Good. So you definitely need somebody who has a good personality for it.
Good. Well, I will be posting this poster. I got a PDF that's I'll be posting it on my website, and I'll look forward to continuing dialogue, because this is really important. There are so many people honestly believe it's just not imaginable that people who don't have a good life could be good at this. So I look forward to the details. Thanks.